So emergencies can happen at any time, like heart attack, stroke, difficulty in breathing, severe asthmatic attack, or some accident. But what the family members or the bystanders do in the first few minutes can make all the difference and can save a life. So this video will help guide you few tips and tricks to do whenever there is an emergency condition and when to get them to the hospital. Hi, I am Dr. Namrata. I am a critical care specialist. So this video is all about general awareness and educating you about what to do in case of emergency situations. So first and foremost thing that we will do is we will stay calm and call for help. We should have a number on our speed dial. We should know the number of an ambulance, whatever is available in our state or in our city. Call ambulance directly or call your emergency contact number or your nearest hospital. Tell them the patient's age, the condition and the incident that may have happened, and ask them to either send an ambulance if they have available or you get them there yourself. Then depending on the patient's situation, you need to carry out the further steps. Don't try any household remedies or any घरेलू nuska. Professional help is what is important during these emergency times. When the patient having breathing difficulty, what you need to do is make the patient be in seated position, be in comfortable position. Let them be away from the crowd and on an open area where they can breathe properly. So if the patient has any known disease like an asthma, their inhalers should be available with the patient and give them the inhaler. The inhaler is not available, then maybe get them as soon as possible. Some patients who may be on oxygen support at home, you can increase the oxygen support and give them there and there. But this doesn't make you sit at home and relax. You need to contact your doctor or hospital immediately and take the patient there as soon as the ambulance or help arrives. Second, if the patient has any chest pain, then again you need to make the patient be in seated position, comfortable position. Patient can lie down also, and if the patient is not allergic to any medicines, then they can be given ecosprin. This 375 milligrams of ecosprin can be given. A drug named sorbitrate, which I know most of you people may be knowing, but sorbitrate tablet can be given, can be kept below your tongue, which melt away and can have its effect and the pain may settle down. Again, this is a temporary measure. You need to take the patient to the hospital. The next thing is the patient who may be having seizure. First and foremost thing that you need to do is make the patient lie down, be away from the dangerous things. Like if the patient is sitting on the chair, the patient is at the risk of fall, the patient is near some hazardous material, then patient needs to be dragged or the patient needs to be made to lie down. Patient needs to be dragged to a place where the danger is less. Patient needs to be turned on one side. They should not be made to lie down straight. They should be made to lie on one side, either left lateral or right lateral, so that the risk of aspiration is minimal. Don't hold the patient tight. The patient is actively seizing. Let the seizure pass away. If the patient has a history of seizure, they may have a midazolam spray with them. You can give that spray in both the nostril, 2 puff each. Patient may have some medications also for seizure, but don't put any medication, don't put any sugar water or any salt water inside their mouth when they are unconscious or they are drowsy or they are actively seizing, because it can lead to aspiration. Again, take them to doctor as soon as the seizure has stopped. If the seizure is not stopping, then the patient is in status epilepticus and this needs emergency management. Fourth thing, if the patient has become unconscious, then you need to check patient's breathing and pulse. If any one of these is not there, then you need to start CPR immediately. I have made a video on how to do a CPR. You can go and watch that video and learn how to do in CPR. So CPR can have had saved many lives and will continue to save lives in future, but the technique is very important and try to learn the CPR today. The next condition is when there is a severe bleeding, either from the nose or from any body part. What you need to do is apply a direct and firm pressure over the bleeding site if it is present anywhere in the body, and if it is on the nose, then you need to pinch the nose and tilt forward and keep the pressure there for at least 5 minutes. Don't keep on checking if the bleeding has stopped or not stopped. Just keep a direct and firm pressure over the bleeding site for 5 minutes, and if the bleeding doesn't stop, then you need to go to the hospital immediately. Also, in some patients who are on blood thinners, the stoppage of bleeding may take up to 10 to 15 minutes also. So patients who are taking blood thinners like Ecosprin, clopidogrel or some injections, then the pressure needs to be kept for 10 to 15 minutes. Then the next situation, when the patient has accidentally or deliberately taken some harmful substances that has led to poisoning, don't induce the vomiting. That can turn dangerous. Some volatile substances can cause more harm when you are inducing the vomiting. Take them to hospital immediately. Also, what the patient has ingested, if you have a strip of the medicines or you have that bottle, then take along with you so that doctors can give them antidote as soon as they arrive. So now we have discussed about what to do in these situations. There are some not to do things also. First and foremost thing is, don't panic. Stay calm, then only you will be able to help the other person. Don't try to solve everything on your own. Always call for help. Don't try any home remedies. Please seek professional help. That is the most important thing. And if the patient is unconscious or is struggling to breathe or is actively seizing, please don't give anything orally. This can be more dangerous than the disease itself. Now some of the tips that I will give you to prepare for such emergencies at home. So keep some first aid basic things handy and always available at your home. Some medications like sorbitrate, Ecosprin, some inhaler if somebody in your house is suffering from any lung diseases, some nebulization, some first aid kit like gauze piece, bandages, band-aid, some sugar tablets. So these all things can turn handy when there is a disaster or a emergency situation at home. Second thing, make a list of emergency contacts which is easily accessible to anybody. Put the emergency contact number on your phone, or you can keep an emergency contact list in your wallet also. Make a list of nearby hospitals who can provide you the basic care and can provide you the advanced care both. Keep a number of an ambulance also in your contact list so that you can contact them immediately in case of emergencies. Always keep a stack of medicines if you are regularly taking that medications. Don't let them go empty before ordering new ones, because sometimes your basic diseases can also exacerbate, and in that situations you just need to take your regular medicines. So these emergency situations can arise at any point of time. Need to know the basics how to treat this emergency conditions. Also, I would like to emphasize on learning CPR. Please get yourself enrolled in a CPR lecture, or you can learn via YouTube also. But doing and learning is more important than just seeing, because while performing or learning CPR, you will know exactly how much pressure to apply, how much deep the CPR depth should be, and what all adjuncts can be used during providing the CPR. So learn CPR today, and if you have any query or if you want to learn CPR with me, please comment down below and I will make a special video about how to do a CPR. Thank you.